But let's start off with health matters, where scientists in the country are proposing the formulation of a research integrity framework which will ensure the credibility of scientific investigations. Speaking on the second day of the 15th Kenya Medical Research Annual Scientific and Health Conference, Chief Research Officer at KEMRI, that is Professor Elizabeth Bukusi, disclosed that the country lacks an elaborate rule on research integrity, despite having more than 50 research centers, including institutions of higher learning.
Country recording numerous groundbreaking research innovations, experts now say more needs to be done to sustain public trust in research and advance scientific work in the country. According to the Chief Research Officer at Kenya Medical Research Institute, Professor Elizabeth Bukusi, Kenya must embark on promoting a culture of research integrity.
Many countries now have research integrity codes because it's bigger than just the issue of research ethics. It's bigger than did you get it approved, reviewed by a committee. It means who are you when nobody is looking? Are you doing the right thing in the right way, even if nobody is seeing you?
Meanwhile, KEMRI says the country has largely prevented the spread of the deadly Mpox virus in various parts, with only 38 cases confirmed positive out of over 400 samples which it tested. KEMRI Research Director Dr. John Witumbi says the majority of the cases involve long-distance truck drivers.
I think the good thing of doing this kind of thing and is really trying to understand is the disease spreading. And currently, I think the ministry is doing a great job. We are not seeing spread. They are containing it. They are tracking the contacts. I think we learned a lot about how to track our contacts from the COVID-19. So we have done a great job in containing, it's not spreading inland.
At the same time, KEMRI Director General Professor Elijah Songok has faulted the decision by U.S. President Donald Trump to cut foreign aid.
Science is global. It's very unfortunate that sometimes some policymakers want to divide science and say, okay, we cannot support this and then only support this, because one disease does not know borders. It doesn't know politics. It doesn't need visas. That's number one. And number two is that it's a wake-up call for us. Say, okay, there's need for own resources, own revenues, for us to be able to really get our own priorities.
Joseph Wahungu for Lunchtime News.